What are trauma scoring systems and how are they used? Have you ever wondered how medical professionals quickly assess injuries in high-pressure situations? Trauma scoring systems are the answer. These tools help evaluate the severity of injuries and predict patient outcomes. They are especially important in high-risk jobs like logging, deep-sea fishing, and storm chasing, where accidents can happen suddenly and requiring immediate attention. There are several types of trauma scoring systems. First, we have anatomical scoring systems. These focus on the location and severity of injuries. A couple of well-known examples are the Injury Severity Score and the New Injury Severity Score. The Injury Severity Score looks at the 3 most severe injuries across different body regions. On the other hand, the New Injury Severity Score considers the 3 most severe injuries without regard to body regions. Next, we have physiological scoring systems. These assess how the body responds to injury. The Revised Trauma Score is a common example. It uses the Glasgow Coma Scale, systolic blood pressure, and respiratory rate to evaluate a patient's condition. Then, there are combined scoring systems. These integrate both anatomical and physiological parameters to give a more complete picture. The Trauma and Injury Severity Score combines the Injury Severity Score and the Revised Trauma Score to predict outcomes more accurately. In high-risk professions, trauma scoring systems are vital for quick decision-making. For instance, if a logger gets injured in a remote area, a pre-hospital team may use the Revised Trauma Score to assess the injury's severity. This helps them decide whether to transport the patient to a trauma center or provide care on site. In storm chasing, where accidents can occur in isolated locations, these systems assist in effectively triaging patients. The uses of trauma scoring systems are numerous. They help document the extent of injuries, predict morbidity and mortality, and assist in resource allocation. They are also essential for triaging patients, determining whether they need to go to a trauma center. Additionally, these systems are used to evaluate the quality of trauma care within and between trauma centers. They play a role in research, helping to study trauma care outcomes and improve treatment protocols. In the context of odd and high-risk jobs, trauma scoring systems are crucial. They ensure that injured individuals receive timely and appropriate medical care, which can significantly impact survival rates and recovery outcomes. By understanding how these systems work, medical professionals can make informed decisions that save lives in critical moments.